Hey guys, this is Dr. Shumard with Integrative Wellness Center of San Diego and also the author of The Thyroid Epidemic. So today I wanted to talk about, I just got off a webinar. It was an amazing webinar. We had roughly 30 people on the webinar who had phenomenal questions, and I hope that they were able to get some incredible value. But some of the questions they were asking were really good questions. And one of the questions that they were asking, and I think it was probably a question that happened prior or during the webinar, because I went over this during the webinar, but this person was experiencing specific symptoms, right? They were experiencing fatigue, they had weight gain, they had brain fog. What was the other one they had? They had, GI problems. And I think she was also saying, there was one other one as well, I don't remember. But she had all these symptoms that were going on, and obviously all these symptoms, like the fatigue, extreme fatigue, weight gain, brain fog, GI issues, these are common. Oh, the other one was she was having depression. That's what it was, depression. And so she was having these symptoms, and initially when she went in to see her doctor, they thought, well, it sounds like you have a thyroid issue, and they ran the test, and when they ran the thyroid test, it was negative. So she did not have a thyroid issue, so they said. Right, and there was a frustration. I could tell in the question, and she kind of came back with a couple other questions. But the reason why I mentioned this, it just kind of triggered something to me today, is this is a common thing that I see in my practice quite often. Is that many patients, they're going to see their doctor and they're having multiple symptoms, and sometimes they come back and they have no thyroid issues. Sometimes they do. And so what's interesting is that when they don't have a thyroid issue, it's like they're left to say, nothing we can do, it must be in your head. Or what they start saying is, well, maybe you're just stressed out, and that's why you have your fatigued. Or maybe your weight gain is because you have a poor diet, you need to change your diets, maybe go see a dietitian, maybe hire a trainer, start working out better, those sort of things. The brain fog, it's probably associated with this depression issue, so we can give you an antidepressant if you'd like. And the GI problem, we can just give you some medication for that as well. So the focus is trying to address the symptoms. Now, if you're experiencing this type of situation where you have multiple symptoms like this and your doctors are telling you that there's nothing going on, or they can't find a problem with you, or you haven't been diagnosed with a thyroid, well, number one, what I want you to do, can I get this to work, is I want you to look into this specific condition. Hashimoto's. Now, what is Hashimoto's? Hashimoto's is an autoimmune disease. Now, what is an autoimmune disease? An autoimmune disease is where your immune system is attacking and destroying the thyroid. In this case, it would be the thyroid. But there are other autoimmune diseases as well, right? Maybe some of you have heard of this, like celiac disease is an autoimmune disease, like psoriatic arthritis, type 1 diabetes, lupus, rheumatoid arthritis. These are all autoimmune diseases. This is where the immune system is attacking and destroying a specific tissue in the body, and you get that diagnosis. With Hashimoto's, it's the thyroid. Now, here's the reason why I'm saying that, because when you're dealing with an autoimmune condition like this, it is in 3 phases. The first phase is rarely ever evaluated, never really found in the first phase, but it's the first step. The first step is where you start to analyze, and what you analyze is what is called antibodies. So AB stands for antibodies. There are specific antibodies that you can measure to see if you have this condition. What are they? Well, the first one is called TPO, and the other one is called anti-thyroglobulin. It's a long word, I know. Sorry about that. So these are the two antibodies that you can measure. So if you look at these, these are blood tests, right? So you can just run a simple blood test to see if these come up. If these come up elevated, it doesn't matter if one or both come up elevated. It is a positive result for Hashimoto's. Now, in the first phase of this autoimmune component here is where these antibodies will go up. But the person typically doesn't have any symptoms, and if they do, they're minimal in most cases. And if they were to measure for the thyroid, like we talked about on the sheet before, it's normal. So that's the first step. The second step is when you measure the antibodies, they're elevated, but now the symptoms, the person's starting to express these types of symptoms. And there's multiple others that could be happening as well, but the thyroid is still negative. Phase 3 is where you have all these symptoms, the antibodies are high again, and the person's thyroid is now showing a problem. So why is that step-by-step approach so important? Because you could be in a step like this patient right here, more than likely, because roughly 90 to 95%, right? Let's write that in here. 90 to 95% of all thyroid problems is due to autoimmune. It's due to this underlying issue right here, Hashimoto's. So, or another autoimmune like Graves' disease. So this is a step, this is what the body does. The body doesn't just wake up one day and say, oh, you have Hashimoto's, now that's the issue. This is a progressive approach. So what happens is at one time in your life, something or some things occurs that starts to trigger the immune system to start attacking the tissues of the body, specifically in this case, the thyroid. Now, as it starts to attack the thyroid, it's literally eating away and killing the thyroid over time, reducing over time the ability for the thyroid to do its job. So it could take 10, 15, 30, 50 years of this step-by-step approach of these underlying autoimmune attacks before you start experiencing not only the symptoms, but a true diagnosis of a thyroid problem, which they'll put you on a thyroid hormone. Again, not addressing the mechanism of the underlying problem, which is the autoimmune component. So you could be in phase 2 right now, having all those symptoms, or step 2, having symptoms. Your antibodies have not been evaluated because that's not a traditional marker to look at in the traditional model or the medical model. Typically, they don't run these tests. And why is that? Because there's really not any specific approach or treatment to address that underlying mechanism. The only way you can treat autoimmune typically right now in the traditional model is going to be with immune suppressors, steroids, or like an anti-inflammatory or pain medication. It's never going to address why the immune system is attacking the body. So if this person's in that step 2 where the antibodies are going high, the person is experiencing symptoms, they don't feel good, but their thyroid is normal, they're thinking it's totally normal, but they get put on other additional medications like antidepressants or GI medication or pain medication, what